Good morning, students. The today is our topic is about the pathology of the hemostasis. The control of blood fluid condition is adequate correlation between the activity of the coagulative blood system and the anticoagulating one. The bleeding stop is very important for the control of the blood circulation index. The hemostasis system components the vessel wall, the thrombocytes, and the system of the blood plasma, like the coagulative, anticoagulative, the fibrinolysis, and the kallikrein gain. This is the picture. The hemostasis, the vessel thrombosis, the primary hematostasis, the bleeding is stop in the macrovessel, the coagulative secondary, the fibrin clotting formation. By etiology, the heredity acquired, the pathogenesis, the vessel platelets hemostasis violation, and the coagulative, the hemostasis, and the bad reduction of the changes, the hypocoagulation and the hypercoagulation. So this is the mechanism. Hypocoagulation is due to the property of the blood to the form the blood clots which result in the spontaneous bleeding of the hemorrhage very often after the trial of the trauma. So etiology with the thrombocytopenia and the thrombocytopathy and the vasopathy and the coagulopathy. The pathology condition which is characterized by the decreased amount of the thrombocyte in the blood less than 15.010 by one. As a rule of the combined with the heredity of the thrombocyte effect, the acquired thrombocyte is reason of the injury of the thrombocytes by the immune complex, by the mechanical trauma, thrombocyte maturity depression, by the aplastic anemia, red bone marrow injury by the chemical poison and the radiation. So the tumors in the bone marrow metastases are primarily associated of the like the thrombocyte and DIC syndrome. The heteroimmune arises most in the children. Reason change of the thrombocytes antigen structure attached to the virus of the millets and a small attachment of the medicine of the region. Hepatitis vaccine, a clinical courses begin at the elimination of the region conducive to the absolute recovery. Autoimmune means arises most often in the adult region. No immune system tolerance on to the thrombocyte antigen, the provoked and agents like medicine, viruses, and bacteria. So the varicose disease, the IgG amount of the platelets increase in 10 times, main place in IgG synthesis of spleen. Treatment is splenopathy, corticosteroid depression of the immune system. Response by medicine, absolute recovery is not. So this is the picture. The thrombocytopathy hemostasis violation as the result of the there's a qualitative thrombocytic defect or the thrombocyte dysfunction, which is characterized by vessel thrombocyte hemostasis violation appearance of the hemorrhages and the tissue and organs like the Glansman types of intelligence auto receive. Reason is no glycoprotein 2E and 3A. And the pathogen is thrombocyte cannot interact with the fibrogen, so they don't aggregate sign like skin hemorrhage, nasal bleeding, uterine and bleeding, sometimes deadly. So hereditary thrombocytes, because of type of autosomal recessive, a violation of the cyclogenase. Pathogenesis include the thrombocyte aggregation at collagen contact, no granule excretion. Sign include the skin hemorrhage, nasal bleeding, uterine bleeding, sometimes deadly also. So the Hedgeman Purlak's disease, the AR region is deficient of dense granules. Pathogens include the no thrombocyte aggregation after the contact of collagen, no secretion of the granular substance, sign skin hemorrhage, nasal bleeding, and uterine bleeding. The Willebrand Georgian syndrome, a reason the Willebrand's effect deficit, violation of the thrombocytes adhesion. Reason is no glycoproteins, one thrombocytes, pathogens involve the violation of the interaction. Signs include the capillary bleeding. The Bols-on syndrome, the FC deficit, no interaction between the thrombocytes, and again the skin hemorrhage, nasal bleeding, and uterine bleeding. The Wiskott older syndrome, reduced amount of the thrombocyte and dense granules and the alpha granule, the weak adhesion and aggregation of the thrombocytes and the no granules. Sign include again the hemorrhage syndrome appear in the childhood. Deadly bleeding is possible. Leukemia, the granule deficit, thrombocyte because their maturation is accelerated, IgM accumulation, and vitamin B12 deficit and the medicines. Like the thromboxane A2 synthesis inhibitor, like the anti-inflammatory steroid medicine, the anti-inflammational non-steroid medicine, like the aspirin, simulation of camp, like the papaverine and the euphyllene, anabolic steroids. Vasopathy, hemorrhage disease is caused by the functional and the morphological defect of the vessel's wall. So, Randu, osseous disease, like rhythm violation of connective tissue and development of in the vessel of the subendothelium. Lack of thickening, like local thickening, microvessel dilation, like the skeletal collagen of the fibers of the subendothelium vessel are very traumatized. Weak adhesions and symptoms include the nasal bleeding, pulmonary bronchial bleeding, and gastrointestinal bleeding, some of time deadly. Acquired vasopathy, idiopathy is Kaposi sarcoma, unknown etiology, with unknown etiology, like the clots, like the stagnatal etiology, chronic heart failure, local venous insufficiency, the dystrophical, like the and perennial gland hyperfunction, glucocorticoid therapy, visual damage of vasculature, the ciliary gone disease, and the signs include the skin hemorrhage. Coagulopathy means pathological state with the result from the deficit of the coagular system activity. A group of the disease caused by the hereditary deficit or heredity of molecular anomaly of the substance which is control of the blood coagulative properties. Hereditary coagulation classification like the coagulopathy as a result of isolated deficiency of the internal like the hemophilia A, B, C, Wilburn disease, and the Hagman's. The coagulopathy as a result of isolated deficit external mechanism of the prothrombinase activation, a combination deficit, internal mechanism and external one of the prothrombinase activation and violation of the last stage of the blood coagulation. The statistics, the amount of the coagulative types in hemophilia A is 68 to 78%, Wilburn disease 98%, hemophilia B is 6 to 13%, hemophilia C like 1 to 2%. Other types are medically causatory. Hemophilia A syndrome is caused by the hereditary deficit, like the pro-coagulative glucoprotein with disease thrombocytes, antigen marker V8, COF V3 AGR. Hemophilia A etiology means the gene anomaly X chromosome which controls the synthesis of the coagulative glucoprotein. Types hemophilia A positive, hemophilia A negative, non-synthesis and synthesis. And clinical signs include the hemorrhage in the major joints, deep hematomas, skin, intramuscular hematomas, massive and prolonged. Post-hemorrhagic bleedings. The children of the last Russian car is in San suffered from the hemophilia A, hemophilia B. Again, the etiology in gene anomaly X chromosome types are the B positive and B negative. Again, the hemophilia antigen positive and antigen negative hemophilia, no synthesis and synthesis. Again, hemorrhage in major joints, deep hematomas, skin, intramuscular hematomas, massive and prolonged post-traumatic bleedings, etc. So these are some pictures. Acquired coagulopathy, it is polydeficit etiology is immune inhibition of the coagulative factor. K vitamin dependent coagulative factor deficit. Poor vitamin K synthesis, violation of vitamin K absorption and damage of the liver. Heparin are the heroin overdose. This is the mechanism. Cane. Hypercoagulation, pathological property of the blood, which is characterized by the thrombosis formation inside the vessel. A classification acquired and a chronic, like local and diffuse. The etiology infection, sepsis, shock, traumatic, surgical operation, thermal burn, and chemical case, terminal states, acute intravessel. Obstetrics, pathology, leukemia, immune disease, allergy reactions, hypercoagulations like the coagulopathy of the using, uh, and the hypercoagulation and the finishing, hyperthrombinemia, the thromboblastin from the injured tissues and the blood cells come from the blood and the conduce the thrombin formatting and infection active monocytes start to the produce such coagulative factor like V7, X, IX and 2. The thrombocyte aggregation, the erythrocyte and the hemolysis, the humoral protease denoting like the activation of the coagulation factor of the anticoagulative factor like the fibrinolytic proteins. Kallikrein system, protein of the complement system causes of the combination of the great amount of protein disintegration metabolism in the blood. They are very toxic damage to the vascular and wall of the tissues. Blood coagulative factor exhaustion of the coagulative system. Hemolytic hemocoagulative shock like the microcirculation violation, decrease of the arterial pressure, decrease of the central venous pressure, and development of the peripheral bleeding. Like the hemolysis violation in the hypercoagulation, main sign is thrombosis, and in hypercoagulation, the main sign is bleeding. At the same time, the exhaustion of the fibrinolysis system occurs. The thrombocytopenia result from the thrombosis and get amount of formation in vessels. Thrombocytopenia using um, block of microcirculation in lungs, in kidneys, in ventricle, and in intestine, in suprarenal glands, in liver, and the pituitary gland. The coagulation include the extrinsic pathway, the vascular cell, again the prothrombin and thrombothrombin, and the fibrinogen into fibrinogen. Like, also is same from the extrinsic and the extrinsic pathway like platelets, and again the same one. Thank you so much.